So depending on the cause of the subfertility, the advice for treatment will be focused on what we find. So in these situations where there has not been conception within 2 years, the most cost-effective way would be to go down the route of IVF. We get eggs from the lady and sperm from the man and create an embryo in the laboratory and then put back that embryo in the womb. That gives a very good chance to conceive compared to continuing to try or trying to give medications in the hope that ovulation will be improved, because that's already happening. If we find the cause is related to the male partner, and this may be just a slight reduction in sperm count, if that isn't severe enough, we would advise on lifestyle and changing a few things here and there, and perhaps giving them time again up to 2 years will give them a fair amount of chance that they will conceive. If the sperm count is very, very low, or we can't find sperm on the examination, then the advice in this situation will be to consider IVF straight on with a technique that we call ICSI. Men who haven't got sperm on the ejaculate have slightly more than 50% chance that if you were to directly retrieve sperm from the testes, you would get some for these procedures. Because of the number of sperm you might find and the fact that it's not going to be motile or moving around, then they may not be suitable for other treatment except having to go through IVF with ICSI. But we also know that gives them a very good chance that they will get pregnant, which is comparable to couples who have other causes of subfertility. There are also intermediate treatments. For example, if we found the problem to be lack of ovulation, just because maybe there is polycystic ovary syndrome, then lifestyle advice to optimize weight results in nearly 50 to 70% chance that fertility will be restored. If that doesn't work, then we can give tablets that stimulate ovulation for a period of 3 to 6 months, and sometimes up to 12 months. We get a very reasonable chance that fertility would happen and they'll get pregnant naturally. Then there are other instances where couples have tried and they're not quite ready perhaps to go down the route of IVF, or they're thinking of something that is less invasive. So we have a technique we call intrauterine insemination. Intrauterine insemination basically means we would prepare sperm in the laboratory of good motility and concentration and place it directly in the womb of the woman at the time when she's expected to be ovulating. And this gives a very reasonable chance that they may get pregnant naturally. The condition therefore would be that the tubes should be open. So it will be important before you consider this approach of intrauterine insemination that the fallopian tubes of the female partner have been checked and confirmed that they are normal. If the male partner hasn't got sperm and they are going to use donor sperm, then we could use the donor sperm to inseminate the female partner and they will be able to get pregnant. So those are broad categories of treatment options. They range from generally advising couples to try, improve on their lifestyles, and where ovulation is not happening, then we can give tablets. And if this hasn't happened, then in vitro fertilization or IVF may be considered.